There's experiential data. When you look at communities that have oftentimes utilized masks in general for personal protection from when they particularly are themselves sick and have used their mask in public. And we've looked at the rate of this COVID-19 in those populations. And then we're looking at the scientific evidence to bring those two pieces together. Let me just say one thing though. The most important thing is the social distancing and washing your hands. And we don't want people to get an artificial sense of protection because they're behind a mask. Because if they're touching things, remember, your eyes are not in the mask. So if you're touching things and then touching your eyes, you're exposing yourself in the same way. So we don't want people to feel like, oh, I'm wearing a mask, I'm protected and I'm protecting others. You may be protecting others, but don't get a false sense of security that that mask is protecting you exclusively from getting infected, because there are other ways that you can get infected because the number of asymptomatic and mild cases that are out there. And so this worries us, and that's why the debate is continuing about the mask, because we don't want, when we're trying to send a signal that every single person in this country needs to stay 6 feet away from everybody, that needs to be washing their hands constantly and know where their hands are, to send a signal that we think a mask is equivalent to those pieces. So when the advisory comes out, it will be an additive piece if it comes out, rather than saying this is a substitute for. And we want to make sure everybody understands it is not a substitute for the presidential guidelines that have already gone out, and to be absolutely clear about that.